I was working as the crowd doctor at the Kia Oval since 2007, and many of the fans used to come to the medical room and ask to have a blood pressure checked. I thought having a captive audience of men in their 40s was an ideal opportunity to offer health checks. Since then, we've been offering health checks to a number of grounds across the country, and to date we've actually conducted over 3,500 free checks, including for diabetes, blood pressure, high cholesterol, obesity, dementia and mouth cancer.
My BMI went down from 29 to 25 and I lost a couple of stone.
I think we've had some very positive responses from these individuals. I personally have experienced a number of people who've said, you know what, that's really interesting, I'd like to take that away. In fact, I didn't know that. Oh my God, is that so? And when you hear that kind of comment come back to you, you think, I've made a difference.
We've been working with Boundaries for Life for 3 years now. The event's been very successful, oversubscribed. The event's been so popular that we've had to turn people away. We've opened it up to our staff who also engage, and we've found overall the reception has been highly positive.
Boundaries for Life is an example of a project that we can use to kind of make tangible differences to the health of the individuals we engage on a match day or the health of the staff that we've got at the club. So we use programs like Boundaries for Life to build a platform to develop projects and programs that have a health theme but actually can help make a tangible difference to individuals and individual communities that we work with.
I think there's a potential model to target those who are vulnerable. Men in their 40s to 50s tend not to visit their GP, have a little engagement with the health service, and particularly those from ethnic minorities tend to not see their GP. And if you look at the prevalence of conditions such as diabetes and cardiovascular disease, it's higher amongst the South Asian communities. So if we can use cricket, which is heavily followed in these communities, to promote health, then we can actually help target these patients and prevent things like strokes, diabetes and heart attacks.
This is an audience we haven't been able to reach before. These are men 40 years old, maybe smoke, drink, a large Asian community who use betel nut. This has helped them raise their awareness of mouth cancer and also take it on to their families a bit more.
Tottenham Hotspur Foundation has delivered over 4,600 health checks in the community targeting males in the east of the borough. Tottenham Hotspur's brand is very powerful, certainly in the community. It draws people over and kind of generates that interest from the community because they want to know what Tottenham are delivering and what they're doing in their community.
What they did engage with was the subtle, humorous, non-invasive messages that we were promoting. So they were messages in the matchday programme, they were emails, there was even things like toilet stickers, whereby some of them did write to us to say, from the health promotion we did in a non-invasive way, they realised that they had, for example, signs and symptoms of different cancer. So that was some real success, and I think that's something that could be promoted and could be utilised in other football stadia and perhaps rugby stadia as well, where again it's quite a fast-paced environment.
Football stadia, cricket stadia that we see today at Lords can be excellent settings to promote health through simple policy changes and interventions that can improve the health of fans, obviously, but also local communities and also to members of staff who work there.
My role in the conference today has been able to share our approach to supporting healthcare charities, and there are great opportunities to deliver a preventive approach to general health care in different environments, and what better place than at cricket matches.
Initially there was no funding for this project at all, and I actually self-funded it for 4 of the 7 years out of my personal funds. It's quite hard to find government money to conduct checks for people that might not be in the locality of the ground, which is why we are quite keen to train up community staff to take these checks into local areas around the clubs to make it more sustainable for people in local communities.
So, yes, it is just practice.
In order to scale it up, the only way to do that is for the foundations to take ownership of doing these checks themselves. So BHR provides a complete bespoke solution for that. So we provide the equipment, we provide the complete training package, the accreditation, we provide hand-holding, any software solutions that they would need to capture the data and to analyse that data. And you can see the foundations and the cricket boards acknowledging the fact that they can make a difference.
The main goal is to actually embed health checks into sports and use the badge of the sporting ground to increase the foothold in people taking up these checks, and also to encourage people to link up with their sports grounds to engage with more health activities.
I think Boundaries for Life would like to be involved all the way along the line, but as I see it, it's going to grow beyond. And I wish it does grow beyond, and it gets into every cricket ground, every sports ground, every other sort of community-based area where people get together in large numbers.
In 2015, I was diagnosed with a small stroke, secondary to underlying diabetes, high blood pressure and high cholesterol that was completely undiagnosed. And I think my view now is that if I can actually stop one person from going through what I went through, then it's actually worthwhile.